Okay. Good evening, everyone. I'm Rita Fleming Castaldi, and it's my pleasure this evening to be presenting the webinar on behalf of Therapy Ed about frequently asked questions about the 2024 MBCOT OTR exam and effective certification exam preparation for educators. I'm Rita Fleming Castaldi, and I am Therapy Ed's Director of OT Education, editor of Therapy Ed Certification Review and Study Guides, and a Therapy Ed course instructor who's had the pleasure to work with some of you over the years. For those who don't know me, I have been an occupational therapist for over 44 years, specializing in mental health practice, community participation, disability rights, and historical literacy. In addition to my Therapy Ed roles, I'm Professor Emeritus at the University of Scranton and the chairperson of the Occupational Therapy Leaders and Legacy History Preservation Project. In 1993, I became a program director, and that was when I became involved with helping students prepare for the MBCOT exam. They basically came to me very stressed and said, please help. So we developed our own program, and that is where I had the privilege today to work with Colleen Marr. In 1998, I joined Therapy Ed to work on the first edition of the Review and Study Guide, which was published in 2000. So 3 years later, and I've just completed the 10th edition of this text, which was completed to reflect the new 2024 MBCOT exam for the occupational therapist. I am joined today, as I said, by Colleen Marr, my former colleague, who is the author of 4 chapters in both the OT and OTA Review and Study Guides, a Therapy Ed course instructor, and an item writer. So now my current colleague again. I had the privilege to work with Colleen for many years when I was program director, and she was instrumental in development and implementation of our program's exam preparation course. Colleen?
Oh, thank you, Rita, and welcome everybody. I'm so happy to be here tonight. I started out as an occupational therapy assistant 40 years ago, and from there I went on to become an occupational therapist and fell in love with the field of OT. I specialized in upper extremity orthopedics, but I worked in hospitals, home care, subacute, and I'm presently teaching. I've been teaching for the past 13 years, and I'm now teaching at a university in New York City and have been very fortunate to also teach with Therapy Ed. And I think it's a fantastic program that Rita has headed. It's wonderful. So welcome, everyone.
Okay, thank you, Colleen. Okay, I'm going to go over a few logistics before we get to the heart of the matter. We have muted everyone to decrease distractions, but please do turn on your mic when invited to share your questions or concerns. Now, if you have any questions during the formal presentation, please jot them down. Because I intentionally designed this presentation to answer frequently asked questions, it's likely that you receive an answer somewhere along the way. However, and we are going to have a formal presentation, the formal presentation will be followed by Q&A session, during which you'll be invited to place your question in the chat box. But along the way, if there is any point during the presentation where something is not clear, you need clarification, please place your concern in the chat box and Colleen will monitor this and provide needed clarification. We are recording this session and it will be posted on Therapy Ed's YouTube channel. And the link to this post will be sent to program directors and shared on the AOTA Community Academic page and on Therapy Ed's Facebook page. Okay, this session is the property of Therapy Ed, and all portions are protected by copyright. And as you will see, I have very many screenshots from the 10th edition of the Review and Study Guide. So we do not allow any audio, video recordings, screenshots, sharing things. And I know you as faculty members know and respect that, but I do have to formally say it. And I do thank you for your compliance and our adherence to our profession's ethical standards, which we know as academics, we need to enforce with our students also. I also need to say that Therapy is not affiliated with the MBCOT, and that MBCOT, CODA, and OTR are registered trademarks that are owned by MBCOT. All right, what are we going to talk about tonight? This session seeks to answer educators' frequently asked questions about the 24 MBCOT exam for the occupational therapist by providing accurate, current, and helpful. My goal is that this is helpful on the 2024 OT certification exam, the content, format, administration, and scoring, and the relevance of these to graduates' exam preparation and test-taking experience. I also want to talk about the importance of advocating that program graduates with disabilities obtain and use the test-taking AD accommodations for which they are eligible. And I'm going to talk also about options that are available for candidates who are uncertain if they are taking the exam in 2023 or 2024. Plan to take their exam in 2023, but are taken in 2024. What are the options for you and for them to help them prepare? Now, when I initially outlined this webinar, I thought of all the questions I've been asked about the MBCOT exam since July when they announced the new exam format. And I also thought about the questions I'm asked on a regular basis over the years. But as I composed the webinar, that was my outline. When I composed it, I realized it would be impossible to address all of these issues in 90 minutes, particularly if I want to have time for you to ask questions and voice concerns. Therefore, I prioritized the most pressing and time-sensitive questions. And these are the three that are going to be addressing that. The others, which are these that I say resources, will be described. These are things that I have previously addressed in webinars that are available on Therapy Ed's YouTube page. And I am going to update those webinars and present them in 2024. So these are less pressing because they're about curriculum development, integrating preparation to curriculum that doesn't teach for the test, how to help students who struggle. So these are things that can wait and allow us to have more time to actually delve into them. Okay. So, but I am going to share resources about them because I did help them all my objectives that I circulated. So I will share resources that have information about these 3 points so that you can access them at your convenience. And I also want to let you know, because I just met yesterday with a program director. He has a new program. And I am available as Therapy Ed's Director of OT Education to meet with you and your faculty via Zoom to discuss your program's unique exam preparation needs at a mutually convenient time. So be aware of that you can email me for that. If, say, any of these concerns are not something that maybe you want to wait for because you're in the midst of dealing with it. Okay, so what's the format? Let's get down into the format. What has changed? So in July 6th to be exact, the MBCOT announced that the exam was changing in format. And it was changing from being 170 multiple choices and 3 CST items to now being 180 multiple choice items that are the traditional 3 or 4 options, single response items, that we use a lot, they're very common in academia, and a new format called the 6-option multi-select scenario sets. Okay, so that is replacing the CST items. There's no more simulation test items anymore. They're going to be scenario set items. There's also no separate section for the scenario sets, whereas the exam that was based on the content outlined in 2018 and implemented in 2019, you had a separate section for the 3 CST items. They were at the beginning, and there was 170 multiple choices. Now there's 180 items that are objective multiple choice format, and they are distributed throughout between the 2 different types. There is also no predetermined percentage for which are going to be traditional set items or the scenario set items. Now, for the 3 or 4 single response multiple choice items, I forgot to alter this from last night. The test taker must choose one option that is most correct. So it's the standard like we've used all for decades in academia. 3 or 4 options, pick one is correct and most correct. For the 6-option multi-select items, scenario sets, they will get 6 options, 6 answer choices, and they have to choose 3 that are correct. So 3 out of the 6 will be correct, and they have to choose those 3 that are correct. Now, on the exam, and this is an exam hint, and this is a screenshot. I apologize, but I'm a little off on the screenshot, but basically, these we have throughout the text about, and I'll explain what else they cover, but in chapter 1 and 2, there's exam hints in there. So in chapter 1, it tells you there's no combined answers, which those are often a great relief to students because they don't like those A, B, and C, and D, which for some reason anatomy teachers like to do. They're not very popular. So they're always relieved to see that there's no combinations on the exam. Okay. So I'm going to give a multiple choice item. If you just sort of familiarize yourself about how our multiple choices may look on the MBCOT exam. If people can put in the chat box when you come up with the correct answer, and then we'll talk about it. An occupational therapist provides services to enhance the independence and safety of residents of a skilled nursing facility. They perform periodic screening of residents' fall risk. What is the primary purpose of this fall risk? determine environmental modifications, individual balance and mobility interventions, adaptations for safe performance, or establishing need for evaluation. Okay. Nancy. Okay. You are correct. And what led you to pick the correct answer? What was your reasoning? This is what we do in the course, by the way. What was your reasoning for picking the correct answer?
Hi. Because the screening is for determining an evaluation need.
Exactly.
Those
Exactly.
other things might come later.
Exactly. And why I wanted you, to have this experience is this is where many students last night, the choices were very scattered. Okay. And a lot of people really like C, they like D. Some also picked A. They were all over. If there were people who picked D, did pick up on the word screening. Okay. And this is where learning to deconstruct exam items are very, very important because students will sometimes miss that because they go right into the fall prevention. They go into intervention. And the OT process is screening leads to evaluation, evaluation and analysis of that leads to intervention planning. And knowing that NBCOT exam items and the way the domains are set up follow that OT process. And that's very important to know. Okay, now I'm going to give a 6 option scenario set. Okay. And basically this is, I'm going to just show and tell. We're not going to go through all this for time to allow us more time to look at it. And this one is from actually our revised course for 2024, which we'll be presenting in December. So how it will be, how the students will see this on the NBCOT exam is a bit different than the screen. This 4, where it says 4 scenario set items in the set are based on following information. They'll repeat for each item, and then it gives the information. That will be on the computer screen for the exam. It's a split screen. So on the left side will be this information. So the background, old adults recovering from recent MI, discharge, getting ready to discharge, inpatient rehab, second ION, MI, they have COPD. That will stay on the left side. Then they will have item 1 of 4, item 2 of 4, item 3 of 4, item 4 of 4. Okay. So this whole thing will count like as one item, but there's actually 4 items in that item. Okay. So it'll be split. So this will have the information that'll follow every screen. And then this side will have the individual item that's unique for that. So anticipation discharge, the patient and therapist have established intervention goals based on development skills, needs safely engage in desired home management and leisure activity. Which activities are best for the occupational therapist to incorporate into intervention sessions? Select the 3 best choices. So this, we would have the students select, and we would, in the course, we would ask them, what's their reasoning, just like as we did. And it would be related to knowing, MET levels. And the key thing about knowing the MET levels is when we say they're getting ready for discharge, because that's key. Because how do I know which? Well, at discharge, what level of MET does the person need to be? They can't be super low, okay, because then they wouldn't be ready for discharge. And they would not be at the level that would be for outpatient, okay, for outpatient care. And I'll show the answers in a minute. Then it would move into item 2 or 4. So the information would stay the same. And now this is during the session, focused on home management activities. Patient SpO2 drops from 89 to 95 based on the response. Which should therapists do with the patient during the session would be the key point. So again, do an exercise test, PERS-LIV, Valsalva, work exertion, activities we can no longer perform. Most people trust that out right away because they know that's not what OT does. Okay, so we would go through those and then we would review them. So the correct answers would be preparing meals and playing cards while seating, vacuuming and playing an endurance promoting game, okay, and washing dishes and clothes and cycling at 6 miles an hour, okay. And actually this green is wrong because A is the correct answer, to be honest. The green is wrong because that is too low. B is too low MET. That's a 2 to 3. That should not be discharged. A is actually the correct answer because that's 3 to 5. Okay. And F is also too low and D is too high. Okay. So I apologize. My technology skills are not the best, but it will be correct in the course. Okay.
Oh
And
my.
these answers are having personal breathing, okay, because you've got to deal with it right in the session. Teach them how to realize they haven't decreased vital capacity, so they'll get to that point, and make sure you monitor exertion during the Borg dyspnea scale. And we review these different points, and we show them where the information is in the book. And we also review the point that, yes, MBCOT will name evaluations. Sometimes students are very surprised about that. Sometimes educators are surprised about that. They will name evaluations, specific names. Unfortunately, they don't tell us those names. So how we decide what we include in the review and study guide is basically based upon what's in the common textbooks and what's reported as commonly used in practice. Okay. So that's basically the new format. You know, it's pretty straightforward. And this, by the way, the CODA exam has had 3 out of 6 multiple choice items since 2019. The only thing difference with the CODA exam is each of the 6 option multiple choice item is single. They don't group them into 4. But other than that, it's very, very similar. Okay. Now, how is it scored? Basically, credit is awarded for the selection of the correct answer. A very important thing that we emphasize in the book by framing it as an exam hint: you never ever get points taken away for an incorrect answer. So don't leave it blank. We teach the students in the course, if I have 4 options and I have no clue and I guess, I have a 25% chance of getting it right. If I eliminate 1, or I'm only presented with 3 options, I have a 33% chance of getting it right. If I eliminate 2, which often happens, many test takers get down to 2, right? That's very common. When students are, say, I picked that, but, and they argue why their answer is just as good, it's usually only arguing about one other answer. They usually get down to 2. So that's a 50% chance of getting it right. So we tell students, never ever leave it blank, always filling in, even if you're just making an educated guess or you're just picking your favorite letter. You won't lose any points. Okay. There is also important thing to know about the exam, and to let students know, is that there are things on the exam that are not scored because the MBCOT is field testing them for future exam and they're interspersed throughout the exam. This is a very important point for the students to know, because for 2 reasons. One, the exam is fair. I get very upset sometimes when there are people who are pushing exam prep products who get into fear factor with students. It's wrong. There's no need to be fearful of the exam. Should you make sure you're well prepared? Yes. But the exam is fairly constructed. And what makes it fairly constructed is before things count on the exam, they're field tested. And before they even go on as a field tested item, they're written by people who are OTs with content knowledge in a specific area, who've been trained in how to write items. They do items, they get peer reviewed, get tweaked, then they come on the exam and they don't even count. And then they see how they do field testing, and then they make sure that they're operational before they actually count. So the exam is fairly constructed. The exams are fairly constructed, but you don't know where they are throughout the test. And sometimes students get upset about that. I also advise them to use that to their advantage. If they get an exam item that seems particularly challenging or a little confusing, or they don't know something, I tell them, consider it maybe being field tested, okay, and let it go, because you don't have to get 100% on the exam. And it's true, if something's not written as sharp as all the other ones, it likely is being field tested because they're going to be tweaking it a little bit. But since there are no identifying characteristics to distinguish those unscored field test items from scored items, they must answer everything as if it counts. The other thing that is confusing, but I always tell the students, it's the same as with the GRE. GRE does not have a simple, you got 80%, 70%, 90%, 60%. They don't do that, okay? So getting into statistical procedures is way too complex, but just letting them know that it is fair, and the scores range, the scale scores from 300 to 600, with 450 as a passing score. And that's what they need to know. Okay, so what's the bottom line on the 2024 OTR exam? The format and scoring. It's less intimidating. It's definitely more test taker friendly. It truly is. Having been working with the CST items since actually before 2009 was when they were first introduced, okay? And then they changed the format from in 2009, in 29, somewhere along the way. 209, I forget exactly when they changed it to be yes, no, where they used to have, we selected positive, negative, and neutral, and then they changed that to yes, no. But they've been around for a very, very long time. And there's a lot of anxiety sometimes that are associated, particularly for students who don't take our course, because our course does work with students through the CST items, so they get a sense of mastery because they have a number of samples that they take, so they learn how to handle it. But if they don't, like at conference and stuff, and when I do, I've done webinars, for New York State OT Association, the Nebraska OT Association, and a lot of times there is, concerns about these because I have to answer yes or no. I'm not sure how to do that, and there's a varying number of yes and no options, and they could range from 6 to up to 12. Sometimes people reported. So not knowing when you go from, they did have 4 sections like the scenario sets, but not know when you go from one section to the other, to the other, to the other, how many options there will be, produced anxiety for some students. Now, every single section is going to have 6 options and you select 3. Because also in CST items, there was not like so many yeses and so many nos. There was no set percentage. So if I have, 8 items, is it 3-5, 5-3, or 4-4? So so that had that ambiguity, was very uncomfortable for many students. There's no ambiguity now. 6 options, pick 3, nice and clean. Okay. The other thing was having them all at the beginning was also sometimes intimidating for people because they knew they had to get through those. And then they had 170 multiple choices to take. So they were concerned about their timing. So now they're interspersed, okay, that they're interspersed throughout the multiple choices. There's not that, oh, I got to get this whole section to get to the rest. It all flows together. So there's not this like break that's intimidating. Another very important thing was you can mark and return and review an exam item for all the 180 items. Every item can be marked. You wouldn't want to do that because it's too many, but any item you have a concern of, you can mark, you can hit at the end of the exam, I want to return to it, and you can review it. If you want, you can change the answer. You could not, once you exited a CST item and the section, you could not go back at all. And most important, you could not change any CST answers. Not even if you were in one section and you clicked yes, and you realize later, oh, that's not as good as this one that wants to be yes. You couldn't change that yes to a no. Once you took it, you owned it because it was considered a simulation of clinical practice. And in clinical practice, you can't say do-over. So for example, I used last night is tenodesis. So if you had a CST item in the past, with someone doing tenodesis, and what would be good activity, say a play activity for a client uses tenodesis to play with their child. And one of the options was flattening Play-Doh to make pretend pizza. That would be a bad answer. That would be a no. Say later on you got a hint and you realize, oh, tenodesis, I can't do that. I need to preserve this. Can't do this because that's going to stretch your flex tendons. You can't change your answer. You own that no. Okay. Now they never take away points, but you didn't gain the point. And success on the exam is all about gaining as many points as possible. Now, if you had a multi-select scenario set item, you can go back and change that answer. So it's really much, much more user-friendly. I think it's going to decrease a lot of stress for students just based upon the feedback over them. It's been definitely over 10 years CSTs have been in. So they can change their answers, including the scenario set. So basically the format, it's clean. It's going to be more user-friendly. So we don't need to have any undue angst about it, to be perfectly honest. And I'm not minimizing it because it really is much cleaner and more test taker friendly. All right, so what has changed? Now the content, that's what we need to compare with. And this is where you as educators, like I said to the student who was initially with us, this is what you need to know as an educator. What is different? Do I need to address anything different in my curriculum or not, or in my courses? So that's what we're going to focus on. So how does the 2024 compare to the 2018 practice analysis, which was what was used for the 2019-2023 course? As you will see, not a lot in the major domains has changed. Went from 25 to 23, 23 to 23 is the same, 37 to 38, 1 percentage point, 15 to 16. So basically just 1 percentage point change in one of them, and 2 percentage point changes in 2. That is not going to impact your curriculum. And as you can see, the domains are worded, these are worded exactly the same. This is also worded the same. This is a bit different because it says select and implement to promote healing and enhance engagement. So that's changed a bit. But basically, if you're doing a client-centered plan, we're promoting engagement. So conceptually, the wording may be different, but conceptually, the focus is the same. And in competency and practice management, again, some of the wording has same, but conceptually, it's the same. And how I always explain to the student, basically, because there's a lot of words there. What is it, the crux of it? The crux of it is domain 1 is about evaluating. Okay, it's about the OT process. So evaluation or reevaluation. Domain 2 is our treatment planning and our intervention review. Domain 3 is doing intervention. Okay, select and managing, and what would you do in a session? And domain 4 is all those indirect services. You know, our accreditation, our evidence-based practice, and there, I'll have a number of slides about the specifics that are in domain 4. Okay, so basically the domains have not changed dramatically at all. Okay, so now under each in the MBCOT exam, under each domain there are tasks. So like domain 1 has like 3 tasks. Domain 2 has 3, domain 2 has 3, domain 5 has 5, or 6, I think 6. So there's different tasks that are needed to be accomplished under those domains. And then there's knowledge statements that says, what do you need to know to do those tasks competently, safely and competently? So the task and knowledge statements are largely the same or very similar to 2018 content outline statements in focus. Most of the revised statements are primarily a simplification of language, okay? Or they move things, they're in a different place. Like I'll have a slide about the IEP. The IEP is in one knowledge statement in 2024, it's in a different knowledge statement in 2018, but as far as what we teach our students, they need to know the IEP. It doesn't, make any qualitative change in what you need to teach your students. The most meaningful and significant revisions for 2024 that's different than 2018 is now they give examples of knowledge statements. So they'll say, here's the knowledge, and it says examples include the following, and then they bullet. So it's actually bulleted what the examples are. And these can be very helpful for us as academics because they're quite specific. Okay, they're very, very specific. And I'll have some slides showing the comparison side by side. But they can also be disconcerting if an exam candidate feels they did not adequately learn the content that's identified as essential knowledge for competent safe practice. They say, ooh, I don't know if I know that. Now, I don't know if many students go to the content outline. I encourage them to do that. And we have it in our book, all the information is there. And MBCOT recently updated their website. It's extremely user-friendly now. It's really quite nice. You just click on exam and then it's in a question format, like what's on the exam, you click on that, get to the content outline. It's very user-friendly. I don't know how many students really or exam candidates do that, but for those who do, they may be a little disconcerted if they see something that maybe they don't feel competent in, because it is much more specific than the global statements that were in 2018. So for example, the new exam outline identifies knowledge of vital signs, laboratory values, medication side effects and interactions, and burnout prevention as required for entry-level practice. I kind of was very happy about the burnout one because I've always included that in my professional development course because I think we always needed to address that. So I'm glad they actually put that front and center as a requirement. All right, so here's an example. How does it compare? So here's a task. So task, now the other thing that has simplified is cleaner, the outline. They used to have this task 01, 03, so this meant it was domain 1 and the third task. This meant it was domain 1, the third task, and the first knowledge statement. So it was all coded, but I don't think most people understood the code, so they've made it simpler. They just say the task, and they just say this requires the following knowledge. So they don't have the numbering that they used to have. So it is cleaner to read. So basically, this says the task is determine the influence of task demands and context, occupational performance through the application of theoretical constructs within the practice setting. and then it requires knowledge of. So it's similar in some respects, but a little bit has changed. So this said, it says specifically performance requires the application of therapeutic approaches and models of practice and frames of reference. So it's this specific own knowledge statement. Now that knowledge is just as resources and considerations, and that's listed along with others. Okay, so it's reorganized. So referrals, client records, development history, IEP were all addressed in the 2018 content outline. They were just in a different place or phrasing or kind of inclusive of a broader statement. Okay, so it hasn't changed radically, but be aware of that. So that's consistent, theoretical models. Now, the phrase some examples include is not an inclusive statement, right? Because it says some, so it's not all inclusive. And they're not intended to represent potential content in the whole of it. But the specificity can be helpful, so to make sure at least you have those specifics in your curriculum. For example, knowledge required to implement occupation-based strategies for social participate in activities of daily living, IADL, health management, rest, sleep, education, work, play, social participation, a lot of stuff in this one. Chapter 15 covers all of that, okay? Includes, and these are interventions for cognitive, visual motor, visual perceptual, process, sensory arousal. This was the same in the 2018. However, these extra criteria, there was nothing in 2018 about sensory modulation, proprioceptive input, vestibular strategies, or low vision strategies. These were not specifically identified anywhere in 2018. So knowing that these are specifically identified in 2024 should be like, ooh, need to make sure we pay attention to those. Okay. So many of the examples like that one include information and knowledge requirements that were not included in 2018. And here's another example of that. So in this example, this was 2018, and this is exactly the same. So instead of methods and strategies, it now says techniques. But sensory, motor re-education, pain management, desensitization, edema reduction, scar management, exactly the same. Okay, exactly that the key things that they want you, the task that you're doing has remained the same. Just this beginning part, the stem has changed. But these examples, a manual edema mobilization, which I know Colleen has in her chapter. Okay, and we have some nice exam hints about that. Nerve gliding, which I know Colleen has in their chapter. Neuromuscular re-education and constraint-induced movement, which I know Dan Geller and Glenn Gillen have in their chapter. So we have this covered. Now, I know many of you probably do have this covered too, but you may want to double check on that. So if you do a very careful side-by-side comparison, the 2018 and 2022 content outlines, you really need to do that side-by-side to note the similarities and differences, because and I can tell you because I've done this, it's tedious. Luckily, we and my, when I say me, I mean myself and my contributors to the textbook have done that. So we've done the work of making sure that we're covering all the statements that are new to the exam. Okay. Now, the good part is there's a lot of stuff that's fundamentally the same. So it's not like you have to revise your curriculum. There's a lot that is fundamentally the same on the 2024 MBCOT OTR exam. For example, task 1, evaluation and assessment. Domain 1, evaluation assessment. Task 1 is identifying the influence of development and lived experience, body functions, instructions, values, beliefs, spirituality, identity on occupational performance. Pretty big. You know the stuff about the person. Big task. And the knowledge statement, this is the same as in 2018. This is the same as in 2018, maybe a little tweak of the word. Impact of typical development and aging on occupational performance, health, and wellness across the lifespan. Okay, we have a very, very extensive chapter about human development across the lifespan. And it covers it all, from cognitive to play to age-related changes in all the sensory systems. Now, we front and center in the exam, the very first table, front and center in the chapter is first page, table 5.1, the CDC guidelines. I cannot tell you how much I was asked at conference about the CDC guidelines, both this year and last year. It's very important to know that the CDC guidelines have a lot of benefits, and they have an important role, okay? But they are not a substitute for occupational therapy evaluation. And AOTA is very clear about that in the on their website when they responded to questions about the CDC guidelines. And there are limitations. They can be used as screening or diagnostic tools by providers. And they could be used to establish the initiation, continuation, termination of OT services, but they do not evaluate development in the depth that is needed if a child is going to receive services. They just don't cover it. Okay, they're a quick checklist. So there is a provider out there who says, just study the CDC guidelines. That's a perfect thing now. And to be honest, I've learned from people it's not the best because they don't do development. The way it's organized is not the best for preparing for the exam, is what I've heard. And I've looked at it and I understand what they were saying. But the reality is the information there is not inclusive of what people need to know for the exam. So we put this front and center to let them know that. The information that is in Chapter 5 is inclusive of what they need to know for the exam. Okay. So what is also fundamentally the same? Occupational profile. Okay. Occupational profile used to be in a separate statement. Now it's an example. And we cover needs assessment in Chapter 4. We cover interviews and observation in Chapter 3. Occupational profile is also covered in Chapter 3. And basically I put together a table that basically what are the questions that you would ask. So this helps the students, think about how do you obtain an occupational profile in a generic way that could be applied to the exam. This box, because it doesn't fit and it's long, it also includes additional questions relating to how do you obtain an occupational history, how do you understand the person's environmental and personal factors that can hinder engagement in their desired occupational performance. So it's a very inclusive table that summarizes obtaining an occupational profile. We also have a table from the AOTA that we got permission for that I only so many screenshots, but it basically talks about the OT process because a client, and it's the same AOTA's version of client as person, group, or population is the same that NBCOT does. So we also teach in the course and in the book that you got to be prepared for a client to be a person, a group, or a population. And we have the table that talks about the OT process for all those 3 types of clients. And that's in Chapter 3 also. Okay, and this basically is a screenshot of the 10th edition of Chapter 3 and Chapter 4. And as you can see, it covers the complete OT process, activity analysis. We have some very nice tables about activity analysis, a lot of information about groups. I found that when I teach, I don't know if Colleen, if you found the same, but I find that, people's knowledge of groups and therapeutic groups and group dynamics is more limited than it was in the past because I think we prioritize teaching other things, but groups are definitely on the exam. And then we also have the CDC guidelines for standard and transmission-based precautions in Chapter 3. So this is the generic stuff that you need for all practice. And encompassing practice management, again, it covers ethics, it covers U.S. healthcare system, payment, Medicare, documentation standards, legislation, service delivery models, all sorts of practice settings. Risk management is a big emphasis now on the exam, okay, more so in the past. Professional development and competency development and maintain competence also. And then we have the section on burnout, okay, and burnout prevention that is new to the exam. Okay, fundamentally the same. Oops, went too quick. So all those things that I just showed before about knowing your symptoms of disease and stages of disease. So this is how an exam hint looks in the book. And for each chapter that has diagnostic specific information, I have a similar exam hint. So just to let them know that, yes, you do need to know your diagnoses because it's actually required on the exam. So we do cover all comprehensive current information about all the conditions that limit occupational performance in chapters 6 through 10. Okay, so for the physical disorders, Chapter 6 is musculoskeletal, which Colleen is our author. Chapter 7 is neurological, which Dan Geller and Glenn Gillen and Cynthia August. Oh, I have a wrong screenshot. Cynthia changed her name. I apologize. I didn't realize that. Are the contributors. And then we have cardiovascular and pulmonary disorders in Chapter 8, which is Gina Lehman and myself, and then GI and all the other body systems, including wounds and everything, which I authored with a lot of help from very competent people. Okay, big thing is wound management. Stage of wound prevention and management ulcers. That is the same. Again, it's more an example now. We have quite a bit of information in chapter 9 because it's vital. Stages of pressure, we have the figure, and then we have the factors. So this is very important, like about prevention strategies that would be on the exam. We also have this caution to let students know that, okay, you're studying it in this chapter 9, but be aware this can be a complication of any diagnosis that compromises a person's sensory motor, cardiopulmonary, renal, immunological, and endocrine systems. So we let people know that this information is going to be applicable to many different clients. Okay, and again, in chapter 8, we cover things like vital signs, lab values, post-surgery as far as, from an MI. And we have things about post-cancer, and cancer rates. We cover a lot of different things. This is one example in the box. And I was actually shocked when I went through 2018 that there was nothing about suicide in the 2018 content outline. So I am grateful as a mental health practitioner that this was identified. Okay, a new one. This is basically, this information has been on the exam for 2018, but now they specify medication side effects and interactions. So in all the chapters that relate to diagnoses, if there's anything about medications, we have information. So for example, in chapter 10, we talk about antipsychotics and metabolic syndrome and what that risk factor is. And then we refer them to chapter 9 where metabolic syndrome is talked about. So again, we try to integrate all the information, review and study guides, so it's helpful to educators who use it and also the students who use it for preparing. And we have about the precaution about, medications that can, be at risk for blood clotting. So if someone has a cut. The other thing that's been added to the exam is trauma and adverse childhood events. Okay. We do cover that extensively. We cover child abuse, elder abuse, patient-client abuse, domestic abuse, and intimate partner violence in the book. And we include their prevalence, definitions, types, signs, OT practitioner's role, and legal responsibilities, particularly with the CAPTA, the Child Abuse Prevention and Treatment Act, because that will definitely be on the exam. Because remember, the exam is a licensure exam also. Every state, 50 states, Puerto Rico, Guam, Washington, D.C., all require MBCOT passage, the exam, to pass the exam to be licensed. So all states, and it's a federal law, and all jurisdictions have about Child Abuse Prevention and Prevention and Treatment Act. So students need to know they're legally bound. That will definitely be on the exam. And we have a lot of information in chapter 5 about that. And we talk about intervention foci and resources. And as someone who in all my courses, besides including burnout, I included domestic violence, domestic abuse, and the role of OT in intervening and preventing and advocating and all the things we need to do for people who are being domestically abused or having violence in their life. So we have the radar approach and what is needed. And I use, as I said, and I always tell students, they're not going to probably say the radar approach on the MBCOT exam, because that's something that's not commonly known, but using these guidelines that's in the radar approach will help you get the correct answer. Okay, and this information is covered in chapter 10. We cover all the psychiatric diagnoses and include the symptoms, the signs, evaluation, treatment, medication management, okay, and the psychosocial evaluation intervention approaches in chapter 14. And we cover the different frames of reference and working on a team, evaluation, intervention, and special considerations, including suicide, domestic violence, self-abuse, okay, challenging behaviors. So there's a lot in that chapter. Okay, what has remained the same? What has remained the same is what Colleen has had in the book since the first edition came out in 2000, is physical agent modalities. Now, over the years, they've added more specifics about physical agent modalities, including more about deep thermal and electrotherapeutic physical agent modalities, but we do cover them, and we cover all these that I haven't highlighted. These were in the past. the dry whirlpool hot pack cryotherapy were in the past edition. This is new. Okay, so electrical stimulation. So Colleen has done a fantastic job of really red flagging out the things when you should not be using these. So they're very easy for students to study. And as I mentioned to students last night, they study the red flags, cautions, hints. They'll do very well on the exam because they highlight what you need to know. This is also from Colleen's chapter, orthoses, okay? For managed conditions, this has all been in both the 2018 and the current. So we have some nice pictures now to break up the content. So we cover that. So all our approaches according to frames of reference that integrate and pull together what we do in evaluation treatment are covered in chapter 14 for psychosocial, chapter 11 for biomechanical, chapter 12 for neurological, and chapter 13 for cognitive perceptual. And we cover all the main frames of reference and the approaches that are used. Okay, finally, what is the same on the exam? What is also the same on the exam is ergonomics and universal design and reasonable accommodations. Those are the same for both. So we have a very nice table in chapter 16.1 on principle of universal design, and all 7 principles are provided in this table, and an example is provided for each one so the students know how to apply it. In chapter 15, we have a very good table on reasonable accommodations for people who have psychiatric and or cognitive issues. So there's a lot of resources for students. We have pictures in chapter 15 from the US government now of positions that are lead to repetitive stress disorders, and then how you modify those activities so that the person does not wind up in a having a work-related injury. So there's a lot of visuals in the book and tables. Okay, a new one for the exam. In the past, they did set high and low tech assistive technology adaptive equipment. Now they're saying interface options, process parameters, equipment components. That's a lot. Now we had to make some judicious decisions about what this all means. So we did keep it pretty broad in general of the most commonly used type of things. So this is a box and this is just part of it. This goes for a whole page. About what are the different things that can be used to enable access for a person with disabilities. And it goes into many other things underneath it. So this is just the first 1, 2, 3, 4, 5, 6, 7, 8 bullets. There's like about 6 more bullets in this table. But it's there for the students to know and for you. So again, chapter 15 covers all our areas of occupational performance, from ADL to IADL to work, play, sleep, rest, education, health management. And then 16 covers all the environmental information, including low vision, fall prevention, restraint reduction, and all the accessibility standards and all our standards for mobility devices and seating devices and positioning devices. Also assistive technology, driver rehab, community mobility, driver cessation, covers a lot. Okay, it's a fun chapter to do. Now, fundamentally the same is critically appraised and scholarly research is the same. We have a table with the CAP. Process the CAP. Now this also, I just cut it off at the end of the PICO, but includes all the steps in the CAP process. So it goes through all of the steps for the CAP process in chapter 4. Reimbursement. This one is a big anxiety for students. It's the same though. We've been teaching this for years and it's been on the exam for years. Knowing the policies. We emphasize in the course that the exam is a national exam. So the exam can only test federal guidelines. It cannot test state-specific guidelines. It cannot test what is my Blue Cross Blue Shield plan or my Medicare Plus plan because they can vary. Okay, so I only did Medicare Part B. We have a similar box for Medicare Part A. And we have a box for medical durable equipment criteria. And then we have a box also for homebound criteria. So it's very clear and easy for the students to see. To be honest, a legitimate critique of the text has been that, it's a lot, it's kind of boring, the outline. Now the outline format works because it's very specific and it's bump, 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 bump. And it was actually originally designed using the outline format by 2 professors from Boston University who were hired by Therapy Ed to develop the PT book. I've been doing this in 1998. They were in the early 90s. PT was first. And they did a lot of research about what is the processing, the thought process you need to take an objective exam, a professional objective exam. And what they found is that when students study narrative, case studies, they're reading a narrative description of something, they have a hard time translating it into an objective exam. But when they study in outline format, and when you think about it, how many of us and how many of our students, when we studied something hard, we made our own outline of the key points. We do it all the time. When people prepare for exams, they make their own outlines of the bullets. So basically, Therapy Ed has done the bullets, but it was a lot, and there's a lot of content we have to carry. So having retired from full-time teaching in 2019, I finally had time to break everything up because it does take a lot of time and work to break things up. So now it's much more visual friendly, the textbook. And this is definitely must-know information. They need to know their Medicare because that's the only national insurance we have. And then, as I mentioned, professional burnout is new on the exam. So we have a table that talks about what a prevention for professional burnout. Okay. And these are the things that individuals can do for professional burnout. And you can see we have some of these examples: advocating to obtain a reasonable workload and fair salary, self-advocacy and relearn, stress management. But we included a lot based upon the literature. And my colleague Marlene Morgan contributed this section and did a beautiful job about it. So we have the individual ones listed here, and then this box continues with a section about what supervisors can do and a section about what administrators can do. So it's very inclusive of things that could be on the exam. Okay. So the bottom line about the content for the 2024 MBCOT OTR exam: no content of substance has been removed. Okay, there's nothing that you've been teaching before that they're saying is NA, except, as per Glenn Gillian's and mine issue is, maybe not so much about Brunstrom and Brood and, NDT, but nothing substantial has been removed. Criteria, though, has been reorganized and reworded, but the essential content remains the same. However, many content knowledge specifics have been added. And again, these will require critical review of your evaluation of curriculum and or specific courses to make sure including key things. Now, when students take our course, when they look at the book, it's like, wow. The depth and breadth of knowledge that's required to pass the OTR exam is a lot. Understandably so. OT is very rich. The depth and breadth is rich. And it can be intimidating to those preparing to take it. And the therapy instructors know that. So we purposely remind them that they're no longer students anymore, that to be eligible for the exam, they had to pass challenging coursework and fieldwork. To even get into OT school, their program, they had to pass challenging prerequisites. So they have earned the status of an exam candidate. They've graduated. To sit for the exam, you have to be graduated from an accredited program and complete your fieldwork. So to do that, they've developed a lot of skills and they have a lot of knowledge they can apply to the exam. Now, will they likely need guidance to do this? Of course. Particularly, they've been out on field work. If they have a capstone, they've done capstone. They haven't been thinking in a test-taking mode for quite a while. I know I taught at the University of Scranton for 17 years before I retired in 2019. And previously at NYU for 10 years and at Dominican College for 7 years, some overlap there. And the reality is particularly Scranton was a 5-year program. Their last exam was in their last semester junior year. Then they had fieldwork. Then they have the senior year where it's all about professional development, research program development. Then they have another fieldwork. People with OTD, you add in another field, you're adding a capstone. So students haven't taken an objective exam for at least a year for most students, and often up to 2 or 2+ years. So they're not into test-taking mode again. So they need to learn to get back into that mode. Fortunately, Therapy Ed has over 23 years of experience doing this and solid resources to help them so they don't get overstressed out. Okay. So before I move into those resources, I wanted to make sure I had adequate time to talk about the relationship between testing, accommodation, and exam success, because you as educators are critical to help students understand this. Many times exam candidates' decision to request or not request testing accommodations for the MBCU exam is a very personal decision, and it's often influenced by their personal experience with TAs during their education. Many times students say, I never use them. I didn't need to use my accommodations. Why do I need to apply? It is very, very important for you to emphasize that their experience in their program, in their academic coursework, is not generalizable to the very challenging, comprehensive MBCOT exam. It is not a generalizable experience. The content format and test taking experience, the MBCOT exam, differs from the objective exams that they take in that to test their mastery of course material in your program. So we highlight this very strongly in the book and in the course. We say that if you're eligible for your disability, if you're eligible because you have a disability to take accommodations, get them, any and all, because here's the deal. So I used my practice framework and I did a exam activity demands analysis and environmental context analysis. So when we look at the activity demands of course exams, and this is a table 1, 2 in the book. Have it there, open and show them. When we have our course exams, they're very well defined course content, pediatrics, mechanical, splinting, wheelchair, whatever, very focused. There's limited cognitive shifts because it's all about that one topic. So there's not a lot of cognitive shifting. On the MBCOT exam, it's the depth and breadth of entry level OT. Within the first 5 questions, you could have something about wheelchair, you could have something about restraint reduction, you could have something about Medicare, you have something about DQ veins, I maybe mispronouncing it, you have something about burns, you have something about stroke, Parkinson's, a lot of cognitive shifts. So, because each one is unique and they measure the depth and breadth of OT practice. The other thing is most of the time in our course, we present them in the typical single response multiple choice format, pick 1 out of 4. Now there's that unique 4-section 6 option, multi-select scenarios. That's kind of novel and unfamiliar. I'm not used to picking 3 out of 6. So that's another adjustment. The other thing, even when they have comprehensive exams, because I know many programs do a comprehensive exam at the end of a semester, at the end of a program, they're typically based on prior quizzes and tests for which feedback has been provided. So I review all my quizzes, I review my tests, I'm prepared. The exam items, the OTR certification exam, go beyond purely testing knowledge. They often require application and analysis to the situation. So often is a step, and there is a recorded webinar that I did where I go through the different types of objective exams, and it's the not teaching for the test webinar. And when should you introduce what types of exam items should introduce when in your curriculum. And I strongly urge people not to introduce application analysis questions too early in the curriculum. Students are not ready for that. They need to get that fundamental knowledge. So we do need those very content knowledge questions. We need to know they know the difference between proprioception and the difference between kinesthesia. Okay. The other thing, so the activity demands are different. Also, the environmental demands are different. When our students take our exam, they may be taking them online now at home or in their dorm room, or they're taking them in a classroom that they've had for the entire semester, and you can come and go as you please. The exam is taken at Pearson now. It's not Prometric anymore. It's Pearson VU, but it's a very unfamiliar test-taking center, okay, that you have to complete a security check. You can't just go in and out. You can't run to the bathroom, come back. You can't, also in the classroom, you can often self-select. Often you have a favorite seat that you go to every time. You're not going to get your own personal seat in Pearson. And for an exam that's in your program, you're surrounded by familiar people taking the same exam. Kind of begins and ends at predetermined time. So people are, maybe some people end a little earlier, but it's within a reasonable kind of time range. At Pearson, there'll be people taking diverse exams. Some will be coming, some will be going. So the environmental contexts are very, very, very different, and it's very distracting. So I strongly urge you to urge your students who is eligible to take the accommodations, even if they only use 20 minutes of the 2 hours that they get. That 20 minutes can make the difference between passing and failing. MBCU does adhere to ADA guidelines. TAs can include extra testing time, a separate testing area, breaks. With a separate testing area, that means I can read aloud, which is often an accommodation that people, how people process and think. They read aloud, but you need a separate testing area for that, so an accommodation. Now, Pearson VU test centers, which are replacing Prometric as of January, they allow a variety of comfort items. This is right in chapter 1, so students can easily see these. And these are important because say I do have, like right now, I have because I have a bad back from a car accident. So I have my lumbar support and I have my thing with my feet perfect. They're sitting there for 4 hours. So if they need that, they can bring those. They can be ergonomic positioning supplies. So this is an important list, and you can get this right online at Pearson. And that is where we access it to include in the book. Okay, because obtaining and using TAs can make the difference between passing and failing, I strongly urge you to encourage it, and we encourage it in the review and study guide, in our course manual, and during the course. Okay, how they help ensure success. And it's easy. The testing accommodations handbook is right on the NBCOT website, and the information is clear. Oh, now important thing, I ran out of space on this, so I want to also emphasize, please, for those of you who know that maybe there are students who struggle, or if you use our online assessments exam, which I'll show in a few minutes, that when you see a student who maybe needs extra time, please let them get, if they have not had an evaluation within the last 7 years, let them take advantage of your university's Office for Students with Disabilities to get that evaluations. Evaluations can be extremely expensive. Now, NBCOT a number of years ago has really changed their policy, and they do allow evaluations at within 7 years, which is a nice big shift. So that has saved students a lot of stress. If you have a student who say, "Oh, well, I don't have an eval," have them use your disability office to get that evaluation if you are able, because that can save them a lot of stress and a lot of money. To be honest, these evals are expensive. All right, so what's our experience? I'm going to briefly go over these and be open for question. So since 1997, we've been doing these things. And these are our resources: the review and study guide, which I showed you a lot of screenshots from, and I'll talk about that a bit. Online on-site exam preparation course I'll talk about, online assessment exams, test prep app. Then I'm going to do some concluding, then I'll review these tutoring. Tutoring also is used by programs. Office hour session for students, exam of the week, and our recorded webinars. We have a lot. There's a lot now that has developed over the last 25 years. Okay, the review and study guides. Basically, I have a great team. They're content experts. They make sure they're accurate. They make sure they're current. Colleen is always updating her references up until we go basically to the printer. So we really make sure that we are covering it accurately and fully. We also make sure that we have at the end review questions that help students test their knowledge when they review the chapters. And important to remember, with the price of the book, they get 3 full online exams that mirror the test. And we have in our chapters 1 and 2 a lot of information on how to prepare for the exam. And here's what chapter 1 tells all about the certificate exam process, testing combinations, and also tells you strategies, how to answer the questions, test taking strategies. So we go through all strategies on answering the different types. And then this gives chapter 2 is about how to prepare for the exam and use your clinical reasoning and do a preparation plan. Now,
excuse me, Rita, could
yes.
I just ask a quick question? You had mentioned that they are moving away from the Prometric Center and they're going to be doing it in Pearson. Is that effective January 1st, or when does that start?
Yes,
January 1st.
it is effective. It is effective for the 2024 exams. The last Pearson will be in December. Yep. Now, even though we've broken up, we have a lot of information in the book, so it can be daunting. It's important to remember there's now 296 tables, boxes, figures that highlight must-know content and support visual learners, 287 exam hint boxes that describe the relationship of chapter content to the OTR exam content outline and provide test-taking hints and exam prep strategies to increase this, help them study more effectively and increase their exam efficacy. 152 caution boxes that tell them the things they need to be careful about, okay, because they can cause potential harm. And or they don't reflect best practice, like sensory testing. You got to know the diagnosis. Do you go distal, proximal, distal? You need to know that, because if you don't know it based upon diagnosis, your results are invalid. So we have a caution about that. So you know to focus on those things. And then 66 red flag boxes of the things you really can't do because you are going to cause harm, and or things that require immediate action, like aspiration, DVT, or non-dysreflexia. Okay, so we highlight those very strongly to help them. The other thing to know that helps increase the efficacy of the book is the ends of chapter 3 to 16, which are the content exam. There are open-end content review questions that help them jumpstart, kind of make that transition from planning treatment in my field work, developing something in my capstone, to now thinking about how does this information apply to exam. So rather than going right into objective. So they really are a nice transition for students. There are comprehensive answers provided in the appendix, and there are programs, and you may be one of them, that use our book in their curriculum, particularly like maybe during field work, as a transitional exam prep kind of thing for content review. And there are programs that use these questions as a flipped classroom format. So students answer the questions, they do, things online through Zoom or whatever, through group chats. So it's a great way to engage them and get exam prep into your curriculum without teaching for the test. And these are just two examples. Okay, again, the important thing about the book is they come with free full online exams. The students get a code, the inside cover, and they get access for 12 months to the online learning portal, which contains those exams that simulate the exam. So each one has 180 items that have the traditional 3 and 4 option and 6 option multi-select scenario sets. They're distributed the same as NBCOT. And we do have at the back of the book some guidelines on how to use them effectively, which we always encourage students to read. Then after you get them immediately, you get a score report that gives you very detailed information. It gives the students detailed information so they can develop a targeted exam preparation plan. And this information that I get immediately in the portal will have the amount of time they took to complete the exam, so you can see their time management skills, the items they answered correctly and incorrectly, and then the percentage they answered for the OTR domains, 5 critical reasoning skills, and 9 content categories that align with the chapters. When they receive this report, they can click on each exam item and be linked to a detailed explanation about its rationale. Then the best part, chapter 2, which is unique to Therapy Ed, we have guidelines on how to use their data to revise your preparation plan. No one else does that. They give the score, but then how do I use this information? So in box 2.1, it talks about how to use your domain score and what you need to do if you have less than satisfactory scores. For critical reasoning, if you have less than satisfactory scores, it tells you what to do. And Kara Inda has done a beautiful job of explaining how critical reasoning is applied to the exam. And hold on. And then for the content categories, it gives you the content categories, and these are the 9, and it tells you what to do if your categories are less than satisfactory. And this is how it lines up. Here's the categories, here's the chapters. And this is right in the textbook, so the students can see right away what chapters they need to study. And no one else provides that detail. So what's the bottom line in the review and study guide? They're efficient. Using a single text that synthesizes all the content knowledge that will be tested on the exam saves time and simplifies preparation. It's economical. Purchasing so many products is really expensive, and there's really no need, to be honest. We are the only single purchase certification exam preparation product that includes all the content people need to pass the OTR exam, content-specific questions to assess their knowledge at the end of the chapters and jumpstart their studying, extensive information about effective test taking and time management so they can complete the test within the allotted time, and 3 online practice exams. So the only ones who provide that. Now, so if you have someone, hold on. If there are students who had anticipated they were going to take the exam in 2023, but they're going to take it in 2024, Therapy Ed will give them a free electronic copy of the 10th edition of the Review and Study Guide. So you just have to contact Betsy Pendry or Michelle Emery, and they will get the free. Students who have the 9th edition, and they can also, the portal will be updated. They can access the new exam that will on there. Okay, so they're giving free access to people because they know there's going to be transition here, so they're not going to charge for that. Okay, now briefly about the course, and I know several of you, because I recognize names, you already have the course, but for those of you who aren't aware, we do have an exam preparation course, and that's really critical because there's 2 aspects to exam success. One is doing the content via targeted study plan, and the other is how do I figure out the best answer? And our courses address both of that. There are school discounts available, and your students get basically $30 off from the course if you host a course. The course fee does include the book and includes this manual that basically walks them through the book and book class pass. So we talked about
Rita, we have just a
yes.
quick question before we move on. Could you tell us where they can find information about the new test sites, or will that be sent through NBCOT?
Yes, that will be, it will be in their ATT letter, and it's on NBSOT's webpage. They have a whole announcement about it. So if you go into news, they have an announcement about it. Yes.
Thank you.
Yeah, it's there, and it's clear. Um, so I talked about the manual has self-assessments. This is an example of a self-assessment that we walk students through. So we walk them through about how you review the book and you look at the content, and everything that is a check and a plus is a review thing. You're going to review because you know pretty good. So just review it because that's going to be on the exam too. And then it's 0 negative, you're going to put in your study plan, and we guide them through that. Okay. So our courses are taught by instructors who've had 30, 40 years experience, and they really know what they're doing. They provide essential information about the current OTR exam, what's required to pass, how to develop the reasoning skills, how to break things down, time and stress management, using the course manual. So we walk them through. So the bottom line, we conduct over 150 exam prep courses nationwide. We return to many programs every year. I've been going to some programs over 20 years. The fact that the course fee includes the review and study guide and the online practice exams eliminates the need to buy other exam prep products. That increases the value. And basically, be honest, program directors, deans, who often fund them through grants and or support them being part of a course, and students, we're astute about our budgets. We and what the outcome is. Then we don't waste time or money, and they don't waste time or money on products that do not work. This is our course evaluation for 2022. 2,183 completed the eval, which is a high number, given that people are, it's online now, so people often just exit. But 98% said they would recommend the course, so it works. Okay, online assessment exams. I'm going to briefly go over these because people say, our students want to take a test, and this is basically therapy as alternative to the AKI. These 2 exams exclusively available only to education programs, and you want to see how they're doing. Students with disabilities, the time can be accommodated. They're designed to mirror, so they have 90 items that include both types of items, the multi-select and the regular multiple choice. They are diverse, and they're available free. So if you never use one, you can contact Betsy and get one free for a group cohort. After that, they're $20 for a student. Detailed information about the OLXs, I did a webinar about it, so you can go on Therapy at YouTube, and Therapy Ed's resource guides for program directors and educators have a lot of information about that, and I'll talk about those guides in a minute. So basically, I wanted to show you though what the score reports. After they get the OLX, they get a score report. The student gets one, and the program director gets one. Both of those reports basically include the same thing that's on the practice exams that come with the book. Okay. But then you can see your class. Now, this was for a class that, had not prepared much, but you get to see like, wow, they're not bad in this. They're not very good in this. So you get to see what they're stronger in. And this is before they studied. Okay. So as a program director, how does this help you? The score report data can help you identify students, the individual and cohorts that are having some difficulty. Someone who took 3 hours for a 2-hour exam, they still did very poorly. Maybe they need, or the 2 hours were cut off and they only completed half the exam. Maybe they need accommodations. The domain scores can let you know a cohort's preliminary readiness and individual students. 9 content categories, this is important, can let you also know if you have any program strengths and limitations. If across cohorts, I'm seeing this one area is always low, maybe we need to evaluate that course. And then the critical reasoning strategies. Okay. The bottom line is, and I developed these because I was frustrated with the AKI. Okay. Because what do I do with this information? Because the domains are so broad and even the tasks are broad. So, and it doesn't help me with my courses. So our score reports can inform exam preparation, program evaluation, and curriculum development more effectively than I think other available assessment exams. Not saying they're not valid, but they're not as user-friendly. Briefly, I want to tell you.
Rita, when
Yes?
did the reports come out? When did the testing come out?
The reports for the OLXs are the students get them immediately after finishing, and the program director gets a compilation sent pretty quickly. Okay. They're auto-generated. So just want to let you know that there is tutoring available, one-to-one, a small group. Some programs do pay for tutoring for cohorts of students that are having difficulty, but individual students can sign up for tutoring. They're very personalized, they're very individualized. The one thing I want to emphasize is Therapy Ed never contacts students, exam candidates, to sell more sessions. Okay, it is completely student directed. They decide how many they want, how many they need. They schedule online. Their interaction is only online, scheduling their own thing, and then when they connect with the tutor. Most tutors don't find 1 to 2 sessions sufficient to keep them on track because it's very focused, but we don't upsell, and they're good, they're effective. All right, so the striking a balance. How do we as educators strike a balance? The level of knowledge and test taking skills graduates bring to their exam preparation is linked to their academic preparation. But we need to prioritize because we're developing their skills for practice. That's important. But how do we integrate that into a curriculum without teaching for the test? So we need to use effective curriculum and course development and program evaluation strategies to ensure they get that foundational knowledge they need to pass their exam. So to support this process, my colleague Marlene Morgan and I, because she's very into curriculum drift, how things drift away and all of a sudden you realize you're not covering everything. We developed a resource guides for program directors and educators that include a lot of concrete strategies and tools to facilitate curriculum development. The one for pre-accredited programs focuses a lot on curriculum drift, and the ones for developing programs focus more on development. To obtain this, just email me at rpc1904@gmail or the rpcot@yahoo. And I have a session, recorded session Marlene and I did. Just briefly for other things to let your students know that we have a mobile app that has questions and they basically take questions on the move. We have online office hours. Please let your students know this. They're free, 7 to 8 every Tuesday. They just go on Therapy's website, click on OT, and they click on office hours. We cover content review about foundational knowledge. They can basically ask any question, and they're very popular. And these are the topics we cover. During COVID, we had many people require students to take to attend these as one of the things that they did. That's why we'd have 500 people a week sometimes. But they're very extensive and they're free, 7 to 8 Eastern Standard Time. We have a YouTube channel, and these are some of the webinars that are covered. And in the electronic program director guide, they're embedded. So if you click on the link, you go right to, you don't even have to go to YouTube. They're embedded. So you click on the link and you could go to, helping students who struggle or embedding exam success in the curriculum. You can go right to it. It's embedded. Okay. And these are ones for students that you can share. We have a Facebook page and social media that has an exam item of the week that we post on Thursdays, answers on Sundays, reviewed on Tuesdays. Okay, I know this was a lot. So, and I know Marlene's been monitoring the chat box, but any questions or comments? Okay, Audrey, was your question with the report was about our online assessment exams? Because the report that I said that goes to program directors is only for the online assessment exams. We do not have access to the students' practice exams. Okay, those they do in the privacy of their own home. Okay, so we don't have access to that. So the online assessments exam, how a lot of people integrate them into the curriculum is there's 2 ways to do it. People do the online assessment exams the last semester of the program, and often the scores are very poor. But they purposely do that to give a wake-up call to say, when you're ready for the exam, you're gonna have to take this serious and you have to come back to do this prep course and to get this book and study. So they kind of do as a wake up. And then they do it like after the course. It's a pre-post test type thing. Sometimes people now with electronic, one thing that COVID has taught is we can do a lot of things electronically. So sometimes people do it halfway through field work. And they have, so there's different ways that people do it. And I talk about that in the webinar, and I'll be doing a new webinar about that. No, Pat, there's not a percentage on the exams that are multi-select. Now that is, and they don't name a percentage. That's one thing about the CST items. We knew there were 3. So that's easy for you to come up with an exam that models it, because we knew there were 3. So here is how I use my critical thinking skills. So MECOT said that the 3 CST items took 30 minutes on average, like it was 10.46, 11 minutes, but rounded to 30, okay? So, and then they had 170 test questions. Now we don't have those 30 minutes for the 3 CSTs, and we have now 10 more, 180 questions. So how I came up with coming up with a magic number for our test quiz is we've been advising now, the code is for at least 2019, maybe beforehand, when they did the 6-option multi-select for the code is, we advised the students to take 45 minutes for a 3-option item, a minute for the 4-option items, and 90 seconds for the sixth option for the coda. Now, the code exam, they're just, multiple choice and then six options through 3. The OT ones are a little, so we say 90 seconds. So basically what I did was say, okay, 90 seconds for 1 6 option times 4, okay, is 6 minutes. Okay. Then I added on a minute because you have that extra part to read in the beginning. So I basically said, okay, 7 minutes per item. 8 maybe, because, there's more to read. So say 8 minutes per item. And then basically there's going to be that you have that 30 minutes. So you're going to be using that 30 minutes to answer these 7, to answer something that takes 7 to 8 minutes. So basically I did like 8 into 30 because that was what they allotted, and I came up, we need about like 6, 7 options, and, so we're going to probably do 6 because these are going to be novel to students. So you don't want to flip them out that they're running out of time. So we're going to do 6 for this round. And that'll be enough. So 6 times, how much is 6 times 7? 32. Right. 6. Wait, no, yeah. So 5. So I'm doing my math once. This is where it's bad. I have it all written out. So 5. So 5 times 6 is 30. Okay. So we're going to have 5 of them because 5 times 6 is 30 minutes. And that will be, I have it figured out, but it's not a percentage. You can see it gets complicated. I meant to put up the screen, but I think it's going to be, I think we decided on 6. I have a math one out. That'll be 6 per exam, but they don't tell you. Okay.
Rita, just to clarify too, with those multi-select, they have to get all 3 correct. It's not
no more. That's with the coda. You don't have to get 3 correct, and they changed that.
Oh.
Somewhere along the way, they changed it also the coda because the coda used to be you had to get all 3 correct. And when I went into, because they sometimes will change things in the handbook without announcing, and I periodically check, and all of a sudden it doesn't say that anymore. And I contacted Bob Williams to say it doesn't say anymore. And she goes, "Oh, we stopped doing that," which was nice. I wish we would have known because that's a lot of undue anxiety about getting 3 out of 6 correct. But you don't need in code exams too. Every one you choose. So if you get 2 out of 3 right, you get credit for that too. 1 out of 3 right, get credit for that 1. So it is much more user friendly for scoring. Much more user friendly. And sorry I didn't emphasize that. Thanks for because I said everything that's correct gets credit. Everything that's correct gets credit.
That was
so
a question.
No partial credit, which is very nice.
That's a
so
question.
it really is much more user friendly.
And can you touch on when the review and study guide is actually going to be coming out? And if they're taking the test in 2025, will this new edition prep book be applicable?
Oh, for sure. MECOT does their practice analysis every 5 years. So they did their practice analysis, like 2017 was a practice analysis for the exam that came out in 2019. The practice analysis for this exam that's coming out in 2020 was done in that is coming out in 2023 was done in 2020. Okay. So they did 2018, 2017 to 2020, they started new practice analysis, but the time in between, so 2019 to 2024, it's good for like 4 years, it's going to be good for 4 or 5 years. Okay. For sure. 2025. When you get into 2027, no, even 2020, that's only 3 years after 2024. So 2028 would probably be when they start doing the content analysis, and then 2029 is probably when it will be implemented, 2028. So yeah, it's good for definitely the next couple of years for sure. And they do announce when they're going to start a practice analysis, so you can count them out. They do the practice analysis 1 year, they analyze it 1 year, and then they publish the test. Okay, now this year it was delayed a bit because of COVID. Okay, because they did the practice analysis like during COVID. So instead of coming out like 20, 21, 22, it was 20, 21, 22, and then now 23. So, all right. Yeah, 2025, 2026 is all going to be the same. Yeah, people are really enjoying the mobile app, and it definitely is something that, you know, fits in with students' lifestyle. All right, I'm going to just move to the last slide.
We have another question, Rita. I just it's from Mindy. It says, I know the 6 option are interdispersed, but are all 4 of the 6 questions? Oops, it just moved. I lost it. Are all 4 of the 6 questions set together? If you could just
Yes,
clarify that.
like the example was, it'll be, you know, exam 1 of 4, exam 2 of 4, item 1 of 4, item 2 of 4, item 3 of 4, item 4 of 4. Yes, yes. Okay, I can stay for more questions, but before I turn off the video, I wanted to just ask you to, there's a lot of exam prep products out there, and some are ethical, and you know, there are other ethical products and things that are valid. But I do want you to be critical about some of the products out there. Make sure they are providing current and accurate information about the certification exam content, format, procedures. Last night, there was a number of rumors that students had seen on social media that were just not true about what the exam is about. Also make sure it really is comprehensive and organized and well integrated content so the students can see those links and that it is directly related to the content outline. We spent a lot of time making sure students see those connections. Also, do they provide effective test taking and time management strategies to help them correctly answer exam items, successfully complete the exam within the allotted time? The course emphasizes that a lot about learning how to take things in a time fashion and deconstruct items within the allotted time. And all the practice exams reflect the different types of exam. Again, I wrote this last night for students. I apologize for not changing it. We're required to answer on your certification exam, and real-time experiential opportunities and individualized live supports, the free online office hours, the individual tutoring if someone needs it. Okay, the webinars that are posted online, the webinars I give periodically throughout the year. And really important, are the providers experienced and well-regarded educators? I'm very, very proud of the Therapy Ed team and the people I have the privilege to work with. If you go online and read the bios of the people who are our instructors, they're pretty impressive. And we have people who've given great service to the profession, and they definitely are people of integrity. And we're very proud Therapy team of the quality of our products and resources. And we are confident that when you review of what we have and who our instructors and contributors are, you will answer yes to those questions for Therapy Ed. I hope this was informative, and I appreciate your time. And on behalf of Therapy Ed educators, I thank you for your time and attention. And oh, I don't wish your success. That is from last evening. I wound up last evening, we had a bit of a glitch where we had a cap of 300 and it was filled at 7:01. So I had to today spend a lot of time responding to people who wanted to know how they could access it. It was recorded, as this one will be, and posted on YouTube. But then I also had to coordinate doing an encore presentation for people who wanted an encore presentation. So I forgot to correct this last slide, so I apologize. But I appreciate your support of students in their preparation for their exam and their career as an occupational therapist. Because without you, they're not going to be able to succeed. And we need OT practitioners in the field. That is how I got into exam prep when I was a program director, because students struggled with the exam. They were coders going to go and they struggled. They knew their stuff, but they struggled. So it was, how can we help them succeed? So I thank you for taking your time this evening to participate in this. And I hope this helps you enable your students to succeed. Thank you.